Imagine a huge, dark cave. In it are bats, stalactites and stalagmites, lakes, an underground river. But without light, you can't see a thing. Now, imagine we can switch on a giant arc light. Suddenly, everything is revealed. You can measure the stalagmites, count the bats, and explore the river. Private healthcare in emerging markets is a bit like a large and very dark cave. Getting a clear picture of who is difficult. The sector is changing fast, players have proliferated, and there really is a great deal of secrecy in many countries. Like an arc light, our database product, Emerging Markets, the Top 700, delivers transparency on players in over 50 countries. It's designed to complement Healthcare Nova, our news service covering the sector from Chile to China, which provides comprehensive M&A coverage, insightful interviews, and in-depth national surveys. So, what do you get in the Top 700? For each company, we provide a short, factual profile which typically details facilities, possibly bed numbers, and gives you a clear idea of what they do and where. You'll also find a revenue number, usually for several years, and we tell you whether this is an actual, an estimate, normally from a competitor or consultant, or whether it is a rough estimate, which means a projection based on bed numbers, scatter graphs, and the like. We've got a carefully defined set of 15 subsectors: private hospitals, laboratory services, dentistry, and so on. And for each company, we tell you what their main type of activity is, and also what else they do. We also tell you which other countries they're active in. You can also see if they have private equity as investors. Some 200 of the 700 do. And if so, we name the private equity house. We also say whether they're listed on the stock market. Surprisingly, perhaps, 100 are. All this, plus contact data, including normally the chief executive's name, and a link to their website. A subscription doesn't just buy a one-off view, but is an annual service, and our analysts and journalists update the data on a weekly basis. So, what can you do with your new arc light? Well, quite a bit actually. You can immediately identify the top players by country. The top 20 for Colombia, the top 20 for Nigeria, the top 70 for China, and the top 100 for India. Or you can ask, who are the top lab or elderly care groups across emerging markets, or in a particular continent, or which operators in, say, China and India have private equity backing and revenue of over $50 million. All this also means you can quickly calculate market share for, say, the top 10 private hospital players in a country. All in all then, this is a pretty powerful piece of kit. It represents well over a man-year of labour time. Because we have contacts around the world, we're also pretty sure that it really is completely comprehensive. So, who's going to buy it? Well, it eliminates a lot of legwork for any would-be acquirer or advisor. It should also be of interest to investors and suppliers who want to make sure they really are addressing all the market. In fact, I argue that anyone with an interest in emerging markets and private healthcare should buy this product. For more information, please give us a call. Thank you.